Good morning and welcome to Radio Friends on Tuesday, May the 22nd. I want to introduce you to Dr. Adnan Qureshi from MU Healthcare. Good to have you here, Doctor.
Thank you very much for having me here.
My first question is, did I pronounce your name correctly?
You were close enough.
Okay, all right. You're here to talk about Stroke Awareness Month. May is Stroke Awareness Month, right?
That is correct.
How many people will suffer a stroke in a year period in the United States?
So essentially, we're looking at 750,000 people every year. So,
750,000 people?
Yes, so we are close to 1 million people every year in this country will suffer a stroke-like symptom.
A stroke-like symptom, is that different than actually having a stroke?
Actually, no. The correct interpretation would be that almost 1 million people will suffer a stroke or a minor stroke.
How do you know if you are having a stroke?
So that's a very good question, and I think the importance of trying to know that you're having a stroke cannot be highlighted more at this point, because today we actually have treatment for stroke. So essentially, the sooner that you can recognize that you're having a stroke, the more likely you're to benefit from such a treatment.
Yeah. So what is the most outstanding warning sign?
So essentially, there can be several things, but the most common ones are that if one side of the body is not moving appropriately or is weak, if your speech is different or you have lost your speech, if you have lost your vision, or one side of the body you cannot feel anything, those would be the typical symptoms or typical manifestation that you're having a stroke.
How long do you have to get to the hospital or treatment before you have irreparable damage?
I think that's an excellent question, and the answer is the sooner the better. So what we do know is that to get maximum benefit from all the new treatments that we have, you have to come to the hospital as soon as possible, and preferably within 6 hours of actually having the symptoms.
Oh, within 6 hours. Oh, I thought it was like within a half an hour to an hour.
So the correct interpretation there is that every minute that you delay, your chance of having a better outcome keeps going down.
Okay.
So even within 6 hours, if you come at 1 hour versus you come at 5 hours, there's a clear difference in the benefit that you will get.
Should you, if you feel that you're having a stroke, should you immediately call 911 or should you attempt to drive yourself to the hospital?
I think that's an excellent question and a common mistake. The correct response is that you must always call 911.
Don't try to take yourself.
That I think is a very bad idea.
Okay. Okay. So the best thing is if you feel that you're having a stroke, even if you're not having a stroke, but you think you may be, it's better to err on the side of caution, right?
You're absolutely correct, because sometimes you may not be clear that you're having a stroke, but indeed you are actually having a stroke. And by the time you may get to a point where it's more clear, you may have missed the opportunity to receive any treatment that could have reversed the effects of those stroke.
Okay. Doctor, thank you so much for coming by. Obviously, we could go on and on about this, but I think the information you gave us is important to remember. If you have slurred speech or one side of your body is not moving properly or your vision, call 911 immediately.
That is correct.
Okay. Doctor, thank you so much for coming by.
Thank you.
If you want more information on any of this, you can go to the MU website. That would be muhealth.org, and you can find out more information. Okay? But keep that in mind. If you feel you're having a stroke, 911. Call that immediately.